Welcome to Speak Up and Stay Alive Radio with author, speaker, and your host, Pat Rouleau.
Serving you a generous helping of everything you need to know to help you and your loved ones stay safe during any doctor or hospital visit.
The program is not intended to replace medical advice from a licensed professional, but rather to encourage you to become a well-informed participant in your health and well-being. And now, your host, Pat Rouleau.
On average, victim will leave and return to their abuser 8 times before they leave for the final time. Because as somebody that isn't abused, you can't even imagine how controlled a victim can feel and how they almost long for that once they leave, because that's all they know.
Hello and welcome. I'm Pat Rouleau, your hostess for this next hour of tips and tools to help you stay safe and healthy and keep you out of the healthcare system. I'm glad you've joined me today. This week, I got to thinking about the word abuse, and I realized that it covers a lot of territory. Abuse definition number 1. The use of something to create a bad effect or for a bad purpose. Abuse definition number 2, to treat a person or an animal with cruelty or violence, especially regularly or repeatedly. So with those definitions, we have 2 seats on the seesaw. One is what we typically think of when we talk about abuse, violence, cruelty, and harm. But what about the other? The use of something to create a bad effect or for a bad purpose. Wow, that happens all of the time. It made me think about the onslaught of abuse we as individuals deal with every day and their effects on our health, our privacy, our security, and our well-being. We have big business that force feeds us genetically modified foods that damage our health. Abuse. We have big pharmacy that drugs us and entices us to want more via well-crafted drug ads or mandatory vaccines. Abuse. We have big telecom that radiates our brains as we happily yak away on our cell phones. Abuse. We have the weather modification ghouls who spray us with chemicals from the sky. Abuse. Or what about the weather people? You know, the old-timey meteorologists who actually predicted the weather. They're gone. They now read from a script, most likely delivered by the geoengineering people, whoever they are. Abuse. The FDA that caters to special interest groups instead of public health. Abuse. The FTC, the NSA, the IRS. Oh, and what about the media? You can't watch your local news, read your local paper. You cannot watch MSNBC, CNN, Fox, ABC, NBC. Nothing is fair and balanced. It's skewed, bought and paid for, and you only hear what you are supposed to hear. In this age of information and technology, we are being abused by the puppet masters, and we do what and believe as we are told. Is that abuse? You bet it is. So today, I'm going to sit on both seats of the seesaw and share both kinds of abuse. I'll begin with the healthcare hazard of the week with a story that shows how physicians are being abused by so-called scientific medical studies. You may remember, a few shows ago, I exposed that there are really only a handful of scientific publishing companies that control the flow and dissemination of literature. Abuse, if you ask me. If our doctors don't get complete and accurate information, how are they to treat us properly and safely? Therefore, we become the next layer of abuse. And later in the program, I share a visit to a domestic violence shelter, the other seat in the abuse seesaw. I want to give a broad brushstroke to the idea of abuse today as a way for all of us to think about the health ramifications of all aspects of abuse. From a cosmetic company that stretches the truth about their facial product, to an industry that falsifies medical data to line their own pockets, all the way to a violent partner who injures and batters without fear of retribution. And that leaves a far deeper scar than any other type of abuse for sure. So with that, let's get started, because right now it's time for the healthcare hazard of the week. It's Wednesday afternoon and you look like H-E double hockey sticks? Well, that's what a friend told me last week when we met for a late lunch. What are you saying? I asked. Yep, she said. I just read an article that said women look their most wrinkly and haggard at 3:30 on Wednesday afternoons. Well, I glanced at my reflection in my spoon. Wow, maybe I did look a little bit older than I did earlier at noon. Where did you read that? I asked. She reached into her purse and pulled out an article from the Telegraph. Sure enough, an expert from the tanning brand company Saint-Tropez, who somehow has time to conduct scientific surveys, says, "It's fascinating that 3:30 p.m. on a Wednesday is the time women look their oldest." The expert continues, "For maximum anti-aging benefits, it's essential that women get 7 to 8 hours sleep a night." Well, then she throws out the "you can't win for losing" statement that too little sleep keeps your skin cells from being able to rejuvenate, while too much sleep results in puffy, older-looking skin. Seriously, what should I do? How much is too much sleep? How much is too little? Oh my! Well, fortunately for me, and all of you ladies facing yet another upcoming Wednesday afternoon at 3:30, Saint-Tropez concluded its study by announcing its new product called Gradual Tan Plus Anti-Aging Multi-Action Face. Ha! Once again, similar to drug ads in magazines and television, cosmetic companies create a problem based on a product with a supposed solution. Just a marketing thought to whomever named the product. It's too many words. I can't even remember what it's called, and I just said it. And what exactly is a multi-action face? Well, that got me to think about healthcare safety, as you would expect from me. So here's a question. Can we trust most medical studies? Here's the scoop. It just makes sense that studies funded by a particular industry or company tend to favor that industry or company. In a world-known study published in the Public Library of Medicine, a famous Greek doctor argues that most published scientific research is wrong. In it, he states that as much as 90% of the published medical information that doctors rely on is flawed. He says that the field of medical research is so pervasively flawed and so riddled with conflicts of interest that it might be chronically resistant to change or even to publicly admitting that there is a problem. Well, he continues that the leading journals will publish dramatic, but oftentimes incorrect research. And there also seems to be a bias towards publishing positive results. For instance, among the studies submitted to the Food and Drug Administration about the effectiveness of antidepressants, almost all of those with positive results were published, whereas very few of those with negative results were. But negative results are just as informative as positive results, just not as exciting, perhaps? In a quote that has become part of medical school orientations everywhere, David Sackett, often referred to as the father of evidence-based medicine, once famously said, "Half of what you'll learn in medical school will be shown to either be dead wrong or out of date within 5 years of your graduation. The trouble is that nobody can tell you which half. So the most important thing to learn is how to learn on your own." I think that's huge. The author of a recent study at Northwestern and at the University of Chicago says, "For a long time, we were interested by what we believe to be a pervasive problem in modern medicine, namely the spread of new technologies and therapies without clear evidence that they work, which are later followed by contradictions, which in turn, after yet another delay, is followed by changes in practice and reimbursement. First, there is harm to the patients who underwent the therapy during the years it fell into favor, and second, the harm to future patients until there is a change in practice. One of the most notable of complete out-and-out frauds was committed by an anesthesiologist, Dr. Scott Rubin, in 2009 at Tufts University in Boston. Rubin, who wrote about pain relief, was found to have completely fabricated at least 21 papers. The journal, which had published 10 of Rubin's fraudulent papers, stated, "We are talking about millions of patients worldwide where post-operative pain management after orthopedic surgery has been affected by the research findings of Dr. Rubin." Well, this Dr. Rubin has now admitted that he never conducted any of the clinical trials on which his conclusions were based in what may be considered the longest running and widest ranging cases of academic fraud. In fact, he even invented the patients. Other researchers did not know about or participate in Rubin's studies, and their names were forged on documents. The hospital asked the journals to retract the studies, which reported favorable results from painkillers, including Pfizer and Lyrica and Merck and Vioxx. His studies also claimed that Wyeth's antidepressant Effexor could be used as a painkiller. Pfizer gave Rubin 5 research grants between 2002 and 2007. He was a paid member of the company's Speakers Bureau, giving talks about Pfizer's drugs to colleagues. And Rubin also wrote to the Food and Drug Administration urging the agency not to restrict the use of many of the painkillers he studied, citing his own data on their safety and effectiveness. Estimates are that Rubin's study led to the sale of billions of dollars worth of drugs, which may have actually slowed down recovery times for patients. While all of his papers have been removed, let's stop and think about how many billions of dollars were paid by insurance companies, Medicare and Medicaid, for treatments that were simply not effective. And here's a side note. His research that supported the effectiveness of Vioxx, the painkiller, caused at least 3,400 deaths. Well, this Rubin, who blamed his actions on mental illness, no kidding, served a 6-month prison sentence for healthcare fraud and is permanently debarred. Thank goodness. So what should we believe? Too much information is a very real problem, especially when it comes to medicine. Sifting through all of the data is a challenge. What with thousands of medical journals, online journals, social media, not to mention drug reps. And most folks, doctors included, when they do read a study, they quickly jump to the abstract and the conclusion without taking the time to read the full study and perhaps question the motives of the parties conducting and funding the study. Do they have a dog in the race? That's always my first question. Yet that's not to say that a drug company, for example, cannot or does not publish an accurate study. Let's just say the antennas should go up. So what's the bottom line? As healthcare consumers, we must take responsibility for our health. We cannot be so blind to think that just because something is in writing, even if it is in a famous medical journal, that it is 100% true. Drug companies are a big culprit. They exist to sell drugs and pull out every marketing and advertising ploy to do so. So the next time you pick up a paper or a magazine and the hot revelation is that this drug or this vitamin now cures all, read the fine print and take heed. Who paid for that study? Well, enough of that. I've got to go grab my Saint-Tropez Gradual Tan Plus Anti-Aging Multi-Action Face so I don't continue to look like HE double hockey stick next Wednesday at 3:30. Now, let's hear some legal news you can use. Each week, you hear me talk about my friends at the law office of Schraff & King, located in Willoughby Hills, Ohio, and today I want to share just a brief moment about some of their specialties and backgrounds. Pat Schraff is a certified elder law attorney by the National Elder Law Foundation and is one of only a handful within the state of Ohio. Her practice is concentrated in the areas of estate planning and administration, guardianship, probate litigation, and long-term care planning. She is also attorney for the Geauga County Department on Aging's Legal Services Program. Pat has been an integral part of the aging community, serving on the boards of the Long-Term Care Ombudsman, the Alzheimer's Association of Greater Cleveland, and she is currently vice president of the board of the Lake County Council on Aging. David King is an experienced transactional lawyer. He represents closely held businesses, small business owners, and individuals in matters involving business operations and contracts, estate, and succession planning. David is also a member of the litigation section of the Ohio State Bar Association and the Association of Specialists in Aging. John Thomas is on the board of trustees of the Association of Specialists in Aging, which promotes the well-being of older people in Cuyahoga, Lake Geauga, and Ashtabula counties, and he has been named a 2010 Rising Star in Ohio Super Lawyers. So when I suggest that you use these folks to help with your advance directives, medical power of attorney, long-term care planning, estate planning, I do so because that is what they spend their days and nights doing. They have a special interest in aging and elder law matters and can help you or someone you care for. Call them today and let them know I sent you. 440-585-1600. That's 440-585-1600. Call them today.
I'm Jerry the Germ with a Speak Up and Stay Alive healthcare and hospital safety snippet just for you. Here's our expert, Pat Rulo.
Hey, Jerry. Healthcare costs are high enough without adding you to the mix. A hospital stay can affect not only the patient, but the patient's employer. Why? Because of reduced work performance and lost productivity, not to mention increased costs. So what can be done? Invite me to speak. I offer employees a fun way to understand healthcare and hospital dangers so they know how to get out of the hospital faster, how to avoid hazards such as secondary infections or drug side effects that prolong hospital stays, and I'll uncover secret germy hiding places at work. The evidence shows my health and productivity programs make a real dollar and cents difference to an organization's bottom line. Sorry, Jerry, but you've got to go.
Stay safe. Listen to Speak Up and Stay Alive Radio. For more information, go to speakupandstayialive.com.
In your face, all over the place. We're online 24/7. 24/7. You're listening to the hottest.
SpeakUpandStayAlive.com. That's SpeakUpandStayAlive.com.
Ready.
You're listening to Speak Up and Stay Alive, Patient Safety Radio, and I am your hostess, Pat Rulo. Thank you for joining me today. Before we head into my visit at a local domestic violence shelter, I want to clearly and quickly make the case for the health effects of domestic violence. Domestic violence is a healthcare problem of epidemic proportions. In addition to the immediate trauma caused by abuse, domestic violence contributes to a number of chronic health problems, including depression, alcohol and substance abuse, sexually transmitted diseases such as HIV and AIDS, and often limits the ability of the victim to manage other chronic illnesses such as diabetes and hypertension. A critical gap remains in the delivery of health care to battered women and men, with many providers discharging the patient with only the presenting injuries being treated, leaving the underlying cause of those injuries not addressed. The effects of violence on a victim's health are severe. In addition to the immediate injuries from the assault, battered people may suffer from chronic pain, gastrointestinal disorders, psychosomatic symptoms, and eating problems. And although psychological abuse is often considered less severe than physical violence, healthcare providers and advocates around the world are increasingly recognizing the devastating mental health effects of domestic violence, including anxiety, post-traumatic stress disorder, and depression. In addition to the danger of death from injury or intentional homicides due to domestic violence, research also indicates that women especially who are abused may be more likely to commit suicide. The secondary effects of domestic violence involve the victim's ability to function in daily life. Victims of domestic violence often take more absences from work. Because of increased absences and substance abuse, battered women may find it difficult to maintain steady employment. Escaping the violence may require a complete abandonment of their job, home, and belongings. Other effects include the impact of domestic violence on children, family, friends, co-workers, and the community. Children in homes where domestic violence occurs may be witness to abuse, may themselves be abused, and may suffer harm incidental to the domestic abuse. Chronic health problems often plague victims and their families for the rest of their lives. According to a recent survey, domestic violence victims are significantly more likely to suffer from a chronic health condition. Among the 1,000 women surveyed, more than 80% of the participants who had been subject to domestic abuse had an ongoing health issue, compared to just 62% of the participants who hadn't experienced this type of intimate partner violence. Domestic abuse survivors reported higher than average rates of depression, diabetes, asthma, and digestive disease. And they also had elevated rates of impaired brain tissue and immune system dysfunction. We know from science that exposure to violence leads to significant poor health outcomes across the life spectrum, according to Kristen Schubert, the director of the Robert Woods Johnson Foundation's Vulnerable Populations Portfolio. She said, when you make this connection and understand the health, economic, and social repercussions of intimate partner violence, it becomes clear that this is a problem that should concern everyone. Well, obviously, there is so much more to this conversation that we cannot address due to time constraints today, but I do want to share with you a recent visit I paid to a place called WomenSafe, located in Chardon, Ohio. Their mission is to provide emergency shelter and support services to survivors of domestic violence throughout Northeast Ohio, and that includes men and children. I don't want today's conversation to focus only on women and children because men are also victims of this type of behavior. So, let's take a listen to my conversation with Megan Fisher at WomenSafe in Chardon. Hello, I'm Pat Rouleau, and today I am live at WomenSafe in Chardon, Ohio. WomenSafe, Inc. is a 501c3 non-for-profit domestic violence shelter and resource center in its 35th year of service to survivors of domestic violence. Their mission is to provide emergency shelter and support services for survivors of domestic violence throughout northeastern Ohio. And today I'm here to donate some of our handmade pillowcases to the residents through our local internet radio station called Those Radio Kids. Those Radio Kids is a youth-driven station specifically for Geauga County. And one of the perks of being a sponsor of the station is that part of the sponsorship helps pay for new fabric, which we and our sewing group transform into beautiful one-of-a-kind pillowcases that we either deliver to homeless veteran shelters, women's shelters, and today to the residents of WomenSafe. The pillowcases that I have with me right now are on behalf of our most recent sponsors, Chardon Lakes Golf Course, Salem Media Group, Junction Auto Family, Wicked Woods Golf Club, The Sport Rack, and Pioneer Waterland. So a big thank you to those fine folks and businesses. Now, we've been donating our handmade pillowcases for several years now through my personal radio show, Speak Up and Stay Alive, Patient Safety Radio, that's heard every Saturday morning. Here's a little plug at 9 o'clock on WHKW and WHKZ 1220 AM in Cleveland, Ohio. And all of our book sales and speaking fees support the Pillowcase Project, and often we mail to combat support hospitals overseas. So today, it's a pleasure to keep it local. And with me to share a bit about WomenSafe is Megan Fisher, donations coordinator at WomenSafe. Now, I contacted Megan last week to see if their organization could benefit from our pillowcases, and she happily said yes. So now I'm hoping that she will share a bit about the important work that's done here at WomenSafe. So welcome, Megan.
Thank you, Pat.
Let's just start off. Tell us what WomenSafe is all about.
WomenSafe is a domestic violence shelter located right here in Chardon. We accept residents not only from Geauga County, but Lake, Ashtabula, and Cuyahoga as well. These are residents that come and stay with us because they feel unsafe in their home and they don't have another place to stay at the moment. We are not a long-term homeless shelter, so on average our residents stay between 6 and 8 weeks. That's obviously on a case-by-case basis. Some cases are more intense and need a longer stay, and some of them are shorter. When a resident comes and stays with us, we have on staff counselors, resident care workers that specialize in housing searches, job searches, resume building. We have court advocates and lawyers that are here to help in any court battles that the residents are going through, whether it be a domestic violence court case or child support, anything like that we're here to help with. Each resident has meetings with all of these resident care workers and the counselors. We provide counseling as well as art therapy for both adults and children, because we do have men, women, and children that come and stay with us. Once the residents are here, they meet with all of these resident care workers and counselors, and we help them basically put their life back together and find a home. Once they do find a home, we try and stock their apartment or house as much as possible, whether it be anything from bedding, furniture, bathroom items, kitchen items, anything at all, because some residents that come and stay with us only come with the clothes on their backs.
Wow, this is a huge, huge organization. It does quite a bit to help folks feel safe and then to transition back out. What would be the trigger? How would someone know that they needed your services? What typically would have to happen for someone to say, I've got to get out of here and find you?
Well, most of the time it happens over a long period of time. Most people that are in a domestic violence situation as an adult grew up in a domestic violence situation as a child. So whether they were directly abused or their parents were in an abusive relationship, anything like that. So normally once they are in a relationship, like I said, it happens over a long period of time. What people often don't realize is that emotional abuse is just as devastating as physical abuse. We do get people physically abused, but also mentally abused as well. So on average, victim will leave and return to their abuser 8 times before they leave for the final time. Because as somebody that isn't abused, you can't even imagine how controlled a victim can feel and how they almost long for that once they leave, because that's all they know. I grew up in Burton, Geauga County, and I know that's one thing growing up in quote-unquote, a safe environment, community, that people think that, well, that doesn't happen, that doesn't happen in our town, it doesn't happen in our community, that happens in the city. But honestly, it happens everywhere, and an abuser can be the stereotypical drunk without a job, but an abuser can also be a high esteemed lawyer. It can be anybody, so that's one thing to remember.
That's right, you can't tell by looking. Now, Megan, I would imagine that leaving is often the scariest and most dangerous time of an abusive relationship, and it's so important then to develop a safety plan. Safety planning focuses on the immediate needs of the victim and addresses the level or risk of danger. So help us with that. What should the development of a safety plan include?
Sure. This is one of the first things that we do with our residents as soon as they come into our shelter, just in case they are ever in an abusive situation again. And a safety plan is just basically trying to get them out of their home in the safest way possible. So we start with having them to identify a variety of ways to get out of your home safely, and practice this with your children, just so when things happen in the moment, a lot of times you're not thinking, and so you want to have this, as a habit, and you want to know for sure that you have a safe place to exit. We tell them to pack a bag with medications to make sure that they have everything that they need. We like to have them arrange a signal or a code word with any neighbors that they trust, or a family member and their children as well, in case they're not home and their kids called. This is kind of, it's not necessarily a code word, but I don't know if you guys saw the Super Bowl commercial where the woman calls 911 and is ordering a pizza. That was kind of code for the police, that something wasn't right. We warn them to be aware of possible GPS trackers, whether it be in their cell phones or in their GPS device, to make sure that they're all turned off. We suggest for them to have on hand their driver's license or their ID, both of their birth certificates and social security cards, the victim and their children, any money or bank books or checkbooks, any ownership papers and or payment books. And so just important things like that, which they can have ready just in case they do have to leave, because most of the time when they do leave, it is after an escalation and they don't have time to gather all these things together. So it's nice to have them all together in a safe spot so that they can just grab and go.
Absolutely, and this ties in with our show, Patient Safety. I always tell folks to pack and pre-pack a hospital bag, keep it stashed in your closet with all those kind of things that you would need, your list of medications, extra eyeglasses, all of those things, so that, when an emergency strikes, you don't have time to wander through your closet and pack. So this is very similar to that, to have that plan in place, have a little suitcase in place. You might even drop it off at a neighbor's or a friend's or a family member's, huh?
Yeah, that's definitely, as long as that's somebody that you trust, that would be fine.
Oh, excellent. Tell us a little about the living and the cooking arrangements. Is that done for the residents here? It's not like a hotel. I'm imagining they've got to take some of that responsibility as well.
Yes, they do. So it is a communal living situation. We have 5 rooms. In total, I believe we have 27 beds. Plus, we have a few cribs and toddler beds as well that we can put into the rooms as needed. In the 5 rooms, there are sets of bunk beds. So sometimes if a family comes in, they may have their own room, but they also may have to share with another family or two. We try to give them as much privacy as possible, but when our census is high, that's just something that has to happen. But then there is also a communal living area with a TV and a DVD player and things like that, couches, a communal dining area, as well as a communal kitchen. And we make a grocery trip once a week. So we do provide food for the residents, and we sit down with them and ask them to make a grocery list, and we try and accommodate them as best possible. But ultimately, we have to do what's best for the communal as a whole. Each person also does have an individual cupboard where they're able to keep food that they buy for themselves also. Some people do have transportation. We do provide transportation for work and school and doctor related things. So as well as court related appointments. We do provide a once a week trip to Walmart that if they don't have transportation, that they're allowed to come with us, buy whatever they need. So they do have to cook for themselves. They each have chores that they have to complete every day. That's rotated every day. We also have a communal washer and dryer area. And so we work hard to provide all of the cleaning products, all the laundry detergent, everything like that. That's also something that's a high need because we go through it so fast just because there's so many people. There's a kids room, a teen room, as well as an education area where people can go to just have some quiet.
Excellent. So there's so many ways that you give help, and I saw that on your website where you have a tab that says Get Help and Give Help. So let's switch over to the Give Help side, because it sounds like there are needs that maybe folks within the community can help out with. So share some of those with us.
Yeah, definitely. So as I stated earlier, we accept items basically for everyday living because we try and provide clothing as well as hygiene products, but then also items for the home. So kitchen items, bathroom items. So that includes, anything from pots and pans to dishes to a coffee maker to bath towels. We also accept furniture. Furniture is a little bit harder just for space reasons. We try and keep as much on hand as we can, but we do have a storage unit in the back or a storage building that where we keep all of our donations. We do accept twin and full mattresses and beds, as well as couches, love seats, dressers, dining room tables. And if anybody is interested in donating any of those items, they don't have to be new. Gently used is perfect, and they can, contact me and we can set that up. As well as we do have a need for volunteers as well, because we are a nonprofit. We could use more staff than we have. We do rely on volunteers a lot for anything from office work to helping me in the donations building to cleaners. We actually do have a group coming out on Saturday. That's what people like to do is they'll get a group together and they can just come out for a day and we can make it a whole work day and get a lot done. So.
Oh, that's exciting. So this is a call to action, folks. Those that are listening, if you've got any furniture, any appliances, whatever, don't have a garage sale and sell them for $4. Here's a place that they can donate them and then also get your group together and come out and help for a day. This is exciting. Where should people go to find out more information about you and what you do at WomenSafe?
Well, you're welcome to go to our website, www.womensafe.org. And I always just like to throw this in there. When you go on to the website, which a pop-up shows up that says, be careful, because if you're a victim, that spyware, abusers can put spywares in your computer, and then they can see what you've been doing, even if you delete your history, so they can see that you've been looking into WomenSafe, and that can cause, a lot of repercussions. So make sure that you're on a safe computer, and so I just really resonated with me that I never would even think about that.
I'm going to interject here because I did see that it said you can there was a little tab that said you can exit safely.
Mm-hmm, yes.
And first I'm thinking, what does that mean? And then it dawned on me. So yeah, things to think about that you normally wouldn't. So yeah, so give us the rest of the contact location information.
If you would like information on volunteering or on donating any items, you can contact me directly. My phone number is 440-286-7154. And my extension is 230. Again, my name is Megan Fisher, and I'm the donations coordinator. As well as email me. My email is wsdonations, so it's WS as in WomenSafe donations, @windstream.net. If you would like information on getting help from WomenSafe, please feel free to call our COPE line, which is 1-888-285-5665, and they will put you in contact with somebody that can help you out with your situation.
Excellent, and I will put all of this on our website. Is there anything that you want to bring up that we didn't talk about today?
The only last thing I wanted to bring up was we do have a resale shop in Chesterland that we receive all the direct proceeds from. It's a thrift shop. They work all on donations and volunteers as well. They take donations anytime they're open, so you don't need an appointment. For security reasons, if you're bringing a donation to the shelter, it's accept by appointment only, just because you don't want to show up and get the cops called on you. But the resale shop, they take donations anytime. And what's nice is that if there is ever anything that I need that we don't have here, I can just run right up there and get it from them. So that's another great way to help us out as well, because like I said, we do receive all the direct proceeds from them.
Well, Megan, what a pleasure to meet you and to learn more about WomenSafe. And I really appreciate all that you do, appreciate your time. And I'm going to encourage all of our listeners to head over to your website and to donate and give help freely. Thank you so much.
Thank you, Pat.
Well, it's that time for our newest segment, News and Views I Choose to Share with You. Do you remember last week when I shared a Miss America contestant's talent? A monologue about being just a nurse? Well, apparently she was belittled on a little-minded TV morning show, The View. And boy, does this ever fit in with today's topic about abuse. It's everywhere. A gaggle of nasty women on The View making fun of a nurse? Do I smell a bit of jealousy here? The contestant is obviously beautiful, smart, talented, and empathetic. Clearly not requirements to spew nonsense and abuse every morning on TV. Well, even the Washington Post weighed in an article called, "Is Nursing a Talent? You can bet your life on it." Mockery of a Miss America contestant reflects a misunderstanding of what nurses do. This is written by Alexandra Robbins on September 17th, and it's said in part, "Are speed painting and artistic roller skating more admirable talents than saving lives?" That's what we might take away from the discussion on The View this week when two co-hosts mocked Miss Colorado's Kelly Johnson's talent portion of the 2016 Miss America pageant. In her scrubs and sneakers, common nurse footwear, but you have to admire a pageant contestant who wears sneakers on stage, Johnson delivered a moving monologue about how her work with an Alzheimer's patient reminded her that she is more than just a nurse. Johnson, a valedictorian of her nursing school class and pageant's second runner-up, is a piano player too. But rather than take the safe route with a traditional talent, she used her moment in the national spotlight to warmly pay tribute to her profession. She also demonstrated better than any other contestant that night that she is an excellent spokeswoman, well equipped to handle the ambassadorial role of Miss America. But the next day, Michelle Collins of The View laughed. She said, "There was a girl who wrote her own monologue, which I was like, turn up the volume, this is going to be amazing, like, let's listen." And she came out in a nurse's uniform and basically read her emails out loud, and shockingly did not win. It was like, that is not a real talent. I swear to God, it was hilarious. Well, my note, had this crazy show host actually paid attention, she would have known that Miss Colorado was not reading emails, but rather telling a story about a real-life relationship with her Alzheimer patient. And there's nothing humorous about that. To which Joy Behar, the other host, quipped, "Seriously?" as she watched the clip. "Why does she have a doctor's stethoscope?" Well, here's my note. Another idiotic comment. Exactly why is it a doctor's stethoscope? Nurses use stethoscopes more often than doctors do, my friend. Wow. The writer of this article continues, "After following 4 nurses and interviewing hundreds for a book about nursing published this year, I can state unequivocally that nursing is a talent. Anyone can sing, but most people don't have what it takes to be a nurse." Well, nurses quickly went after The View with a Change.org petition and a hashtag on social media called Nurses Unite that went viral. And on Wednesday, the hosts issued a non-apology claiming that their comments were, quote, taken out of context and suggesting that angry nurses heard them wrong. Did they hear the conversation? Raven Simone wondered. And Whoopi Goldberg whooped in and cautioned the audience to better listen to the show. But I think that their comments reflect widespread misunderstanding and in some cases disrespect of what nurses actually do. Nurses don't get enough appreciation for their work. The gal that wrote this article said they told me that patients frequently assault them. Some doctors regularly belittle them and visitors often treat them like waitresses. Some hospitals help to perpetuate the doctor-nurse hierarchy. And we talked about that last week. At Vanderbilt Medical Center in 2013, administrators cut costs and risked cross-contamination by forcing nurses to perform housekeeping duties, including emptying garbage cans, changing linens, sweeping, and mopping patient rooms and bathrooms. At some hospitals, nurses are the only employees who are charged for parking. Well, these supervisors' message is clear. They value doctors more than nurses and treat them accordingly. And Johnson is right. No nurse is just a nurse. We couldn't survive without them, and it takes a heck of a lot more talent to earn the scrubs and stethoscope than it does to mock a hero on a 2-bit television show. That's just another example of how pervasive abuse is in today's world. Now, in another article, Why Doctors Are Sick of Their Profession by Dr. Jahar, who is the director of the heart failure program at the Long Island Jewish Medical Center, and this essay is adapted from his new book, Doctored: The Disillusionment of an American Physician. What happens when doctors are unhappy? They have unhappy patients. He writes, "All too often these days, I find myself fidgeting by the doorway to my exam room, trying to conclude an office visit with one of my patients. When I look at my career in midlife, I realize that in many ways I have become the kind of doctor I never thought I'd be: impatient, occasionally indifferent, at times dismissive or paternalistic. Many of my colleagues are similarly struggling with the loss of their professional ideas. It could be just a midlife crisis, but it occurs to me that my profession is in some sort of a midlife crisis of its own. In the past 4 decades, American doctors have lost the status they used to enjoy. In the mid-20th century, physicians were the pillars of any community. If you were smart and sincere and ambitious, At the top of your class, there was nothing nobler or more rewarding that you could aspire to become. Today, medicine is just another profession, and doctors have become like everyone else, insecure, disconnected, and anxious about the future. In surveys, a majority of doctors express diminished enthusiasm for medicine and say they would discourage a friend or family member from entering the profession. In a 2008 survey of 12,000 physicians, only 6% described their morale as positive. 84% said that their incomes were constant or decreasing, and most said they didn't have enough time to spend with patients because of paperwork, and nearly half said they planned to reduce the number of patients they would see in the next 3 years or stop practicing altogether. American doctors are suffering from a collective malaise. We strove, made sacrifices, and for what? For many of us, the job has become only that, a job. That attitude isn't just a problem for doctors, it hurts patients too. Consider what one doctor had to say on Sermo, the online community of more than 270,000 physicians. "I wouldn't do it again, and it has nothing to do with the money. I get too little respect from patients, physician colleagues, and administrators, despite good clinical judgment, hard work, and compassion for my patients. Working up patients in the emergency room these days involves shotgunning multiple unnecessary tests as everybody gets a CT, a CAT scan, despite the fact that we know they don't need them. And being aware of the wastefulness of it all really sucks the love out of what you do. I feel like a pawn in a money-making game for hospital administrators. There are so many other ways I could have made my living and been more fulfilled. The sad part is we chose medicine because we thought it was worthwhile and noble. But from what I have seen in my short career, it is a charade." Well, there are many reasons for this disillusionment. One unintended consequence of progress is that physicians increasingly say they don't have enough time to spend with patients. And at the same time, salaries haven't kept pace with doctors' expectations. The return on educational investment for primary care physicians is just under $6 per hour, as compared with $11 for lawyers. Some doctors are limiting their practices to patients who can pay out of pocket without insurance company discounting. U.S. doctors spend almost an hour on average each day and $83,000 a year dealing with the paperwork of insurance companies. Their office staff spends more than 7 hours a day. And don't forget the fear of lawsuits, runaway malpractice liability premiums, and finally the loss of professional autonomy that has led many physicians to view themselves as pawns in a battle between insurers and the government. And this growing discontent has serious consequences for patients. One is a looming shortage of doctors, especially in primary care, which has the lowest reimbursement of all the medical specialties and probably has the most dissatisfied practitioners. Try getting a timely appointment with your family doctor in some parts of the country. It is next to impossible. Perhaps the most serious downside, however, is that unhappy doctors make for unhappy patients. Patients today are increasingly disenchanted with a medical system that is often indifferent to their needs. People used to talk about my doctor. Now, in a given year, Medicare patients see on an average 2 different primary care physicians and 5 specialists working in 4 separate practices. And for many of us, it's rare to find a primary physician who can remember us from visit to visit, let alone come to know us in depth or with any meaning or relevancy. Insensitivity in patient-doctor interactions has become almost normal. I once took care of a patient who developed kidney failure, he writes, after receiving contrast dye for a CT scan. On rounds, he recalled me for a conversation he'd had with his nephrologist, the kidney doctor, about whether his kidney function was going to get better. The nephrologist said, "What do you mean?" My patient told me, "I said, are my kidneys going to come back?" He said, "How long have you been on dialysis?" I said, "A few days." And then he thought for a moment and he said, "Nah, I don't think they're going to come back." My patient broke into sobs. "Nah, I don't think they're going to come back?" That is what he said to me, just like that. What's most important to me as a doctor, he writes, I've learned are the human moments. Medicine is about taking care of people in their most vulnerable states and making yourself somewhat vulnerable in the process. Those human moments are what others, the lawyers, the bankers, envy about our profession, and no company, no agency, no entity can take those away. Ultimately, this is the best hope for our professional salvation. Well, now I shared this with you as a peek into what might be going on with your doctor. Often on this program, we ponder and question why our doctors are so seemingly not interested, rushed, dismissive, and sometimes downright rude. Well, they are people too, and maybe we need to take their troubles into consideration at times. Let's work diligently this week, this year, this lifetime, and give some thought to all of the little ways we might be contributing to abusive behavior. As we've seen today, you don't need to pummel someone to the ground to be abusive. So whether you are a doctor, a nurse, patient, mom, dad, grandparent, child, whatever, if each of us cut back on the abusive comments and the conversations, the looks, the actions, if we curb that desire to have power or control over a person or a situation and simply behave simply, I think we can safely dismount the abusive seesaw and play nicely. But maybe I'm preaching to the choir. Well, that's it for news and views I choose to share with you. You're listening to Speak Up and Stay Alive, Patient Safety Radio, and I am your hostess, Pat Rouleau. Once again, nearing the end of our time together this week. But you can have more if you invite me to speak to your group, your club, your business, church, or hospital. There's so much to talk about and learn, and I promise my presentations are fast-moving, jam-packed, sometimes humorous, sometimes silly, but always filled with life-saving information you can use the moment you leave the event. And after years of doing this, I can honestly say no one has fallen asleep or thrown anything at me. So that is good. Call me 440-725-5462. 440-725-5462. And meantime, get a copy of my book, Speak Up and Stay Alive, The Patient Advocate Hospital Survival Guide. It's only $20, and you can purchase at the website speakupandstayalive.com, speakupandstayalive.com, or you can order by phone, 440-725-5462. It's quick and easy reading, and you will come away with very practical ways to survive any healthcare or hospital encounter. That's why I wrote it. Well, gotta go, but come back next week. Same time, same place, but never the same information. And be sure to share this program with at least 3 people this week. It's just good karma for you. Well, until next time, I hope you have a healthy and a happy week, free from abusive people and angry morning show TV chicks. I am Pat Rouleau, and I am your guide to safe and successful healthcare and hospital encounters.
Listen to Pat Rouleau and Speak Up and Stay Alive RadiOh. Stay safe from little-known healthcare and hospital hazards. To learn more, go to speakupandstayalive.com. That's speakupandstayalive.com.